Good morning. This topic is about brief explanations of cellular adaptation, and this topic contains definition and types of cellular adaptation with its examples. Definition: adaptation is a process by which the cell changes in size, number, and appearance in responses to changes in cellular environment. Changes may be physiologic or pathologic. The cells can undergo adaptation to damaging stimuli and achieve a new altered state that allows the cell to survive and continue to function in abnormal environment. The changes in adaptations are reversible changes. Hypertrophy. So it is defined as an increase in the size of tissue or organ due to the increase in the size of cells. Physiological changes. Hypertrophy of skeletal muscle due to bulging muscles by building the body. Hypertrophy of smooth muscles. Growth of uterus during pregnancy from estrogen stimulation. Pathological changes. Hypertrophy of cardiac muscle, which can be left ventricular hypertrophy due to hypertension or aortic stenosis. Hypertrophy of smooth muscle, urinary bladder muscle in response to urethral obstruction or prostate hyperplasia. So morphological changes: gross, the organs are enlarged, and when we see it in microscopically, the cell sizes are increased. Hypoplasia. Hypoplasia is defined as an increase in the number of cells in an organ or tissue, usually resulting in the increased size of organ or tissue. Physiological changes, which may be of hormonal stimulation or compensatory process. Hormonal: female breasts at puberty, pregnancy, and lactation, uterus during pregnancy. Compensatory hypoplasia, liver following hepatectomy. Pathological changes: excessive endocrine stimulation or chronic injury. So excessive endocrine stimulation, which leads to endometrial hypoplasia due to estrogen secretion, chronic injury or irritation, long-standing inflammation in skin. Pathological hypoplasia can lead to cancer. Morphological changes: gross, the size of the affected organ is increased. Microscopically, it shows increased number of cells. Atrophy. So atrophy is defined as reduced size of an organ or tissue resulting from decrease in the cell size and number. So functions of the cells are also reduced. Physiologically, normal fetal development and in adult life. So fetal development, the changes in embryonic structure, and during adult life, atrophy of brain or heart. Pathological changes, it can be local or generalized. Local: disuse atrophy, poliomyelitis, renal parenchyma, and hydronephrosis. Morphology of atrophy: gross, the organ is small and often shrunken. Microscopy, the cell size are smaller in size. Metaplasia. Metaplasia is defined as reversible changes in which one adult cell type is replaced by another adult type cell. Types of metaplasia: epithelial and connective tissue metaplasia. Epithelial metaplasia, squamous metaplasia. So squamous epithelium is present in the respiratory tract. The metaplasia can be formed due to chronic irritation by tobacco smoke. Columnar epithelium, they are present in gastric glands. So they can be replaced by cells resembling those of the intestine due to the irritation in the gastric glands. Connective tissue metaplasia. So osseous metaplasia, formation of new bone at site of dead tissue injury. Bone formation is known as myositis ossificans, occurs after intramuscular hemorrhage. Dysplasia, a term used to describe the presence of abnormal cells within a tissue or organ. It is called as disordered cellular development. Dysplasia can also be considered as transitional stage linking neoplasia to hypoplasia or metaplasia. Examples: dysplasia cells in uterine and cervix. There is high change of malignancy development. Thank you.